Hi, my name is Priya Mathews. I'm in private practice now in Florida. I did my medical school and master's in public health at Johns Hopkins, and I went to residency at Columbia University in New York, and then went back to Wilmer Eye Institute for my Cornea fellowship. I wanted to share a story about global ophthalmology that really inspired me in my future work. And so here you can see this is Dr. Lisa Park, and during my third year of residency, she took myself and my co-resident to Guatemala for a trip, medical mission. And here's a little picture of the town. We worked with the local doctors and nurses to provide really outstanding medical and surgical care for the patients there. We had a great time. Here's a few photos showing the operating room and us operating, and as well as the patients. And it was an amazing experience that really confirmed my love for global ophthalmology. And I noticed that the cataract care was really amazing there, and a lot of advances had been made. But one thing I noticed was that when it came to corneal ulcers, there was really a lack of options in terms of medical and surgical care. And I was devastated to find out that the country of Guatemala, there was not even a single eye bank. And I wanted to know what could we do. So I called my longtime mentor, Dr. Akpeck at Wilmer Eye Institute, and asked her, what can we do for these young patients who come in with a corneal perforation and we have no options in terms of tissue? And that's when she introduced me to the sterile cornea. And she had used this for many patients in the past, and with good outcomes, both emergency and non-emergency patients. And this tissue really comes from the eye bank. When they can't use the tissue for whatever reason, it can be sterilized and long-term preserved for future use. And an advantage is it's a 2-year shelf life at room temperature and potentially fewer antigens as well. So actually, Dr. Akpeck and CareLink International Eye Bank mailed to us these sterile cornea, which we used, as you can tell here in this picture, we used it for a patch graft in this patient who was very grateful to us. I met Dr. Josephine Christie during my fellowship year, shortly after this experience, and she was telling me about the need for corneal tissue in India. And so together we developed this study along with Dr. Akpeck as well to determine the feasibility and clinical outcome of using this tissue in patients presenting with perforations, either due to infection or trauma. So we wrote a proposal, and we're planning to enroll 30 patients who are presenting with a corneal perforation, and to use this tissue and follow them for a year afterwards. We were actually supposed to start this earlier this year, but then with COVID, everything was paused. So we're really excited about hopefully getting this started as soon as possible. I'd like to thank the ASCRS committee for this opportunity and for funding this study, as well as my collaborators, Dr. Akpeck and Dr. Christie, for working together on this project. And I'd like to thank CorneaGen as well, and they will be donating the tissue. Thank you.